Dear students, Assalamu alaikum. In the last lecture, we learned that the testes secrete several androgens, out of which testosterone is so much more abundant than the others that one can consider it to be the primary testicular hormone. In this lecture, I will continue with the functions of testosterone and the control of male sexual functions by the hypothalamus and anterior pituitary gland. During fetal life, moderate quantities of testosterone are produced throughout the entire period of fetal development till about 10 weeks after birth. No testosterone is produced during childhood until about the ages of 10 to 13 years, when the puberty starts. Testosterone production increases rapidly at the onset of puberty and lasts throughout most of the remainder of life, decreasing after age 50 to become about 20 to 50% of the peak value by age 80. This figure summarizes the different stages of male sexual function as depicted by average plasma testosterone concentrations shown in red line and sperm production shown in by blue line at different ages. Functions of testosterone during fetal development. The SRY protein causes the genital ridge cells to differentiate into cells that secrete testosterone and eventually become the testes. Testosterone secreted first by the genital ridges and later by the fetal testes causes formation of penis and a scrotum, prostate gland, seminal vesicles, and male genital ducts. At the same time, it suppresses the formation of female genital organs by secretion of or by secreting the Mullerian inhibiting substance. During fetal development, testosterone also causes descent of the testes. Now remember here that administration of gonadotropic hormone can also cause the testes to descend. Now let's study the functions of testosterone during puberty. During puberty, testosterone causes development of adult primary and secondary sexual characteristics. The primary sexual characteristics include the effects on external and internal genitalia. Effect on external genitalia include the penis increases in length and width, the scrotum becomes pigmented and rugose. The effects on internal genitalia include the enlargement of testes, the enlargement of seminal vesicles and secretion of fructose by them, and also the enlargement of prostate and bulbourethral glands. The secondary sexual characteristics are the features that differentiate a male from a female. These includes effect on body hair. Testosterone causes growth of hair over the pubis, upward along the linea alba, in the abdomen, on the face, and on the chest. The effect on scalp hair is, however, opposite to that of the effect on the body. So, although body hair is increased by androgens, scalp hair is decreased. There is temporal recession of hairline, and it can result in a condition which is known as androgenetic alopecia, that is baldness, in males who have the gene for the baldness, and also which have the environmental factors that favor this baldness. Effect on voice includes the enlargement of the larynx, vocal cords increase in length and thickness, and voice becomes deeper. Effect on skin. Testosterone increases the thickness of skin, and sebaceous gland secretion increases and thickens, hence predisposing to acne. Anabolic effects of testosterone include that it increases bone formation and muscle development, increases bone matrix, and also causes an increase in the body height. Other effects include increased basal metabolic rate. It increases red blood cells and causes moderate retention of sodium, potassium, water, calcium, sulfates, and phosphates. Mechanism of action of testosterone. Like other steroid, testosterone binds to an intracellular receptor, and the receptor steroid complex then moves in the nucleus and binds to the DNA in the nucleus, facilitating transcription of various genes. In addition, testosterone is converted to dihydrotestosterone by the enzyme 5-alpha reductase in some target cells. Now, DHT binds to the same intracellular receptor as testosterone. Keep in mind that testosterone receptor complexes are less stable than the dihydrotestosterone receptor complexes, and they also conform less well to the DNA binding state. Therefore, dihydrotestosterone formation is a way of amplifying the action of testosterone. This is a schematic diagram of the actions of testosterone shown in solid arrows and dihydrotestosterone shown in dashed arrows. Note that they both bind to the same receptor, but dihydrotestosterone binds more effectively. Now this diagram helps us to summarize the actions of testosterone and dihydrotestosterone. The actions of testosterone include maturation of Wolfine duct structures, leading to the formation of male internal genitalia, spermatogenesis, gonadotropin regulation, and increase in muscle mass. On the other hand, actions of dihydrotestosterone include formation of male external genitalia and sexual maturation at puberty, including events like enlargement of the internal and external genitalia, predisposition to acne, and presence of hair on the face and temporal recession of the hairline. So depending upon where the enzyme 5-alpha reductase is present, which can cause the conversion of testosterone to dihydrotestosterone, the actions are a little bit different in different target tissues. Control of male sexual functions. The control of sexual functions begins with the secretion of gonadotropin releasing hormone by the hypothalamus. Gonadotropin releasing hormone stimulates the anterior pituitary gland to secrete two other hormones called gonadotropic hormones, the luteinizing hormone and the follicle stimulating hormone. Luteinizing hormone is the primary stimulus for the secretion of testosterone by the testes, while follicle stimulating hormone stimulates the spermatogenesis. Effects of gonadotropin releasing hormone. Gonadotropin releasing hormone is a 10 amino acid peptide secreted by neurons whose cell bodies are located in the arcuate nuclei of the hypothalamus. The gonadotropin releasing hormone is secreted intermittently, that's in a pulsatile manner, a few minutes at a time, once every 1 to 3 hours. And this pattern of secretion is very faithfully followed by the luteinizing hormone. So the secretion of luteinizing hormone is also cyclical, following the pulsatile release of gonadotropin releasing hormone. However, follicle stimulating hormone secretion increases and decreases only slightly with each fluctuation of gonadotropin releasing hormone secretion. Effects of luteinizing hormone. Testosterone is secreted by the interstitial cells of Leydig in the testes when they are stimulated by a luteinizing hormone from the anterior pituitary gland. Mature Leydig cells are normally found in a child's testes for a few weeks after birth, but then they disappear until after the age of about 10 years. Effects of follicle stimulating hormone. The follicle stimulating hormone binds with specific FSH receptors attached to the Sertoli cells in the seminiferous tubules, and this causes the Sertoli cells to grow and secrete various spermatogenic substances. To initiate spermatogenesis, however, both FSH and testosterone are necessary. The testosterone secreted by the testes in response to luteinizing hormone has the reciprocal effect of inhibiting anterior pituitary secretion of luteinizing hormone. This figure shows the feedback regulation of the hypothalamic pituitary testicular axis in males. You can see the testosterone is secreted by the interstitial cells of Leydig in the testes when they are stimulated by luteinizing hormone coming from the anterior pituitary gland. Testosterone has a direct effect on the hypothalamus to decrease the secretion of gonadotropin releasing hormone, and this in turn decreases the secretion of both luteinizing hormone and follicle stimulating hormone by the anterior pituitary gland. And the decrease in luteinizing hormone then reduces the secretion of testosterone by the testes. Note here the role of the hormone inhibin. This hormone has a strong direct effect on the anterior pituitary gland to inhibit, I repeat, to inhibit the secretion of follicle stimulating hormone. So this hormone has a strong direct effect to inhibit the secretion of follicle stimulating hormone, as I just mentioned. Inhibin is secreted by the Sertoli cells. There are two types of inhibins, and they are formed from three polypeptide subunits: a glycosylated alpha subunit and two non-glycosylated beta subunit, beta A and beta B. The subunits are formed from precursor proteins. The alpha subunit combines with beta A to form a heterodimer and with beta B to form another heterodimer. So alpha beta A is inhibin A and alpha beta B is inhibin B. Now it has been found that it is inhibin B that is the FSH regulating inhibin. Coming to the role of human chorionic gonadotropin in the regulation of male sexual functions, we know that during pregnancy, the hormone human chorionic gonadotropin is secreted by the placenta, and human chorionic gonadotropin has same effects on the sexual organs as luteinizing hormone. During pregnancy, if the fetus is a male, human chorionic gonadotropin from the placenta causes the testes of the fetus to secrete testosterone. And this testosterone is critical for promoting formation of the male sexual organs, as we have already studied in the previous lectures. This concludes today's lecture.